Depression is an awful illness affecting about 7% of the European population, and it affects those individuals, but it also affects their families, and they can't study perhaps, they can't work normally, so it has an economic impact. So the scorecards are looking at 4 key domains, trying to look at what is being done well, what needs to be done, and what is in progress. And it's aimed at helping policymakers at regional and national government level with things they can do to improve the quality of care and support for every individual with depression.
The burden in our country is considerable. France has one of the highest rates of suicide in Europe. 1 person dies every hour from suicide in France, and global estimates indicate that depression contributes to up to 60% of this death. France has a national suicide observatory which works on suicide prevention. Very recently, a national suicide prevention number has been released with psychiatric professionals that are available to receive calls 7 days a week and 24 hours a day. There's one major weakness in our country, this problem of stigma towards depression that persists in France. This may make it more difficult for people in need, as the fear of being labeled as mentally ill may be stronger than the will to seek help. One of the recommendations of the France Depression Scorecard is to expand awareness of depression as an illness that requires medical support like any other illness to reduce stigma and help those living with depression to seek the care they need.